one of the things you'll notice if you follow politics enough is that oftentimes people on all sides of the spectrum will have contradictory arguments to positions they're trying to put forth. And that's just because they're trying to throw out as many arguments as they can to get you to side with them on a particular policy issue. And they're not looking at it as a whole picture, and sometimes those can contradict each other. I complain about things like this all the time. So here I found one where I think it's particularly amusing. This is a guy from New York City that's advocating de Blasio's plan there where they're going to give free health care to everyone. Now, Tucker's interviewing the guy because he's asking, like, does that mean everyone is in illegal immigrants? And this guy's like, yeah, that means them too. It means basically anyone that would come here is entitled to health care. We think it's a human right. And so the government of New York, I think New York City specifically, would be able to provide that health care to people. Now, it's ludicrous. They'll never be able to do that. One, this isn't even an argument against universal health care, but to do it in a limited scale like that and allow anyone, they'd be flooded with people that would want medical procedures that would come in, and it would slow the course of medical care in New York City to a grinding halt, I think. And as is admitted later in this video, which I won't get into, that they're only putting like $100 million. They're saying that would be able to pay for everything, which is absurd. It's something like $166 per person in New York City, which obviously isn't going to cover their health care for the year. But I'm not really focused on the position as a whole. Like, it's obviously nonsense for New York City to give away free healthcare like this. I'm more interested with the argument, how he's going to defend this argument. So Tucker's correctly being like, look, if you're allowing illegals to have this healthcare, it's going to drive the cost up for everyone else, because now people are just going to fly into New York City and then get off the airplane and say, okay, I want healthcare, and how will New York City be able to afford that? Now I want you to listen carefully to what this man says. It's going to be a very interesting argument.
Look, I think the debate, let me break it down for you. I think actually this is a very effective, efficient, conservative approach to delivering health care. The truth is, undocumented immigrants and those who can't afford health care already get free health care now. They go to the city's emergency room departments. It's a very inefficient way to deliver health care. They go for colds, they go for flus, they go for any number of things. They can't really get mental health treatment. They can't get basic services, so they go to the emergency room. Delivering health care, basic health care, preventive health care through the emergency room is a terribly inefficient way to do it. It's a drain on taxpayer money. This is looking at a way to manage health care better and to be able to sort of give preventive care.
Now, do you hear what he said? He said, actually, it's costing everyone a ton of money because right now illegals go to the emergency room and use it for all sorts of services. Now, wait a minute. Isn't that contradictory to the argument we always hear about illegals? They don't waste money. They're not getting free services. So now this guy's admitting, oh, by the way, one of the reasons your health care costs so much is because illegals in great numbers are going to the emergency room and they're not paying their bills and using those services for their health care. That's an admission of one of the reasons why illegal immigration is bad. But the same type of liberal progressives that are advocating things like universal health care would be the same people that say, oh, illegals aren't getting any of these services. They're not getting services like that. They're not a drain on the economy whatsoever. And you've seen these double standards elsewhere. Healthcare is a good example of it. I remember telling friends when I was young, in college, and Obamacare was coming out, and all my younger friends were like, oh, free healthcare. Yeah, man, I'm all for that. And I'm like, no, it's not going to be free healthcare. What's happening right now is we have a bunch of people not paying for the service and a bunch of people paying for the service that are using it. And what Obamacare sought to do was get a lot of people not using the service to pay for it, that way to drive down the cost for the people that are using the service and paying for it. They didn't understand it. By the way, if you're young out there and you're thinking about that, who's it going to be? What type of people will have to pay for a service and not use it? Well, generally it's young, healthy people. The young people. That's what Obamacare was, a tax on the young. But, of course, my friends just heard free healthcare and thought it would be a great idea, and then most of them ended up griping years later, I don't even have healthcare, and now I have to pay this stupid tax penalty at the end of every year. Yep. Should have thought better when you voted, right? Anyways, one of the arguments you would hear about healthcare that's contradictory is you would hear them say, oh, it's inhumane. There are people going without healthcare. It's the most terrible, disgusting thing. And, like, how can you even believe it? You know, it's so bad. And then the second argument was, oh, and by the way, everyone's going and getting free healthcare at emergency rooms and things like that, and it's driving up the cost for everyone else. Well, wait a minute. Those two arguments contradict each other. It's just like you see this argument also with illegal immigration, which is that illegal immigrants are noble, great people, and they're doing jobs that Americans aren't willing to do because Americans aren't willing to do the jobs at those wages. And then the second argument is, oh, and by the way, our economy is so much better because these illegal... and the first part of that argument, it's the morally correct thing to allow them in here because they're such great people. Then the second argument is, well, and by the way, think of how much your price of produce and things are going to go up if you kick... or your house care prices would go up If you kick illegals out or didn't have illegals here, prices would shoot through the roof. But those arguments are contradictory because the first argument you're making a moral argument, and the second argument you're basically saying, and thank God they're willing to do backbreaking labor at almost no cost. We could exploit that and live comfortably. Well, why? So basically you're making the argument for slave labor. Oh, the slaves are better off here than they would have been at their countries back home. Like in Africa, it would be a terrible situation for them. There's all kind of tribal warfare. Here, at least, you could have noble owners that'll make sure they're getting 3 square meals a day and have a roof over their heads, and they could stick around with their family. And by the way, think of how cheap everything is because of that slave labor. It's asinine. So when you say this to people, they'll go, no, 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 no. We actually think the illegals should be paid more. You're right. They should have all the rights of a U.S. worker. They should be paid at least a minimum wage. Absolutely. They should get workers' compensation and things like that. You're right. You're right. Okay, then the price of all that stuff raises. So your economic argument's out. It's often interesting to see how these contradict, but I just thought it was an interesting point. You can check out the rest of Tucker Carlson's video to see just how ridiculous this whole interview goes about New York City having healthcare. But that really wasn't my focus. My focus wanted to be on the contradiction and how at least we have here a person admitting. You see how people will spin things. On one hand, they'll make the argument, no, illegals are great, they're a benefit, they don't use up resources. On another hand, when it benefits them to try to get something like universal health care, they go, whew, illegals are really a strain on us economically and on our healthcare system, so we need to do something else. So, all right, if you liked the video, please click the like button and the subscribe button. I'll be putting out more videos daily. I should be doing a live stream tomorrow on my friend Drone Tech's channel. I'll put a video up before that with the link, but check that out as well. So, all right, everyone, have a good one.